aspects of language. When we talk about language, we can talk about speaking, as we just saw, but there's also the receptive component of language, or understanding. Writing also is a use of language that's mediated by specific brain systems, as is reading. Prosody. Prosody refers to the melodious quality of speech, and it is often lost in people who have a right hemisphere stroke. This is one aspect of language that seems to be mediated more by the right hemisphere than the left hemisphere, and that's that melodious quality of speech. And you can say exactly the same words, but if I say, go to the store versus go to the store, there's very different communication, and that's the difference that prosody can have in communication. Naming, the ability to name an object. We talked a little bit about that with visual object agnosia. The ability to repeat what is said to you is another function of language, or aspect of language. We know that language exerts a behavioral effect on others. When we say something, other people may have a response to what we say. Aspects of language associated with sharing information with others is also important. We use language to share information with others. I'm sharing information with you now. We use language to accumulate and communicate knowledge from generation to generation. Language is also involved in social behavior, not only courting, but feeding. Hey, let's go eat. We eat together, we talk, and say, hey, it's time to go eat. We also use language for emotional communication. When we're frustrated, we vent, or we have some psychological relief in psychotherapy to talk about things, to try to work through and try to sort through very difficult circumstances. Language is a function that is lateralized, and there was a study back in 2000 that looked at a large sample of individuals, found that looking at those who are left hemisphere language dominant, about 96% of right-handed people have language localized to their left hemisphere. 85% have language localized to the left hemisphere if they're ambidextrous. And even 73% of left-handed people have language in the left hemisphere. So just because you're left-handed doesn't mean your speech is on the other side. 73% of even left-handed people have speech in the left hemisphere. In the right hemisphere, there's only about 4% of right-handed people have speech in the right hemisphere, 15% of ambidextrous people in the right hemisphere, about 27% of left-handed people. So the representation of speech in the right hemisphere is relatively rare. We can see that it's, regardless of handedness, language is localized mostly to the left hemisphere. When we produce speech, commonly we have to first have something to talk about. And what we talk about is usually based on what's happening in the here and now, what's currently happening. And that relies a lot on our ability to process things in our through our senses. What happened in the past, we also talk about. That's associated with memory, or ability to conjure up those previous episodes that we're communicating about. And then we also sometimes talk about what might happen in the future. That's based on imagination, where the neural mechanisms aren't certain, but almost certainly involve the hippocampus in the brain. Intact memory is also associated with trying to visualize the future, as well as prediction. Prediction is based on prior experience or hypothesis formation. That's largely a function of the frontal cortex. In order for us to produce speech, we also have to have our oral musculature be intact. Oftentimes, people who have a stroke will have damage to some of the motor centers that we just talked about that innervate the mouth and the tongue. And so the tongue doesn't move as well, or the mouth and lips aren't able to be coordinated as well. And that sort of produces a slurred speech, which is called dysarthria. Dysarthria is not aphasia. Dysarthria is its own sort of syndrome, but sometimes we can see dysarthria in addition to aphasia. Articulation, as I just mentioned, this dysarthria is a defect in peripheral speech mechanisms of the larynx, pharynx, and the tongue. It's a defect in choosing the desired sound from all those available in a person's repertoire, and it can also be associated with a deficit in the motor system that prevents the proper formation of the mouth in order to produce speech sounds. Some other disorders of production would include word-finding difficulties, or anomia or dysnomia, difficulty coming up with the word for something. Within this realm, we have something called a paraphasia, production of unintended syllables, words, or phrases during a speech effort. So we can have sometimes a substitution of the wrong sound. The person says pike for pipe, or they use the wrong related word. Instead of saying cow, they say milk. What is this? When they're shown a picture of a cow, they say milk. In the first example, we call that a phonemic paraphasia, or a literal paraphasia, and in particular, it's just the substitution of a sound or a phoneme one for another. When we have a wrong word, but it's the two words are related, that's called a semantic paraphasia, and they're associated with damage to different parts of the brain. Sometimes unintended words can be used. Somebody might refer to my mother instead of my wife, which is not usually welcomed by the wife. But sometimes those little unintended, that would also be sort of a little bit of a semantic type of paraphasia. Agrammatism refers to a telegraphic form of speech where the person speaks with a very short phrase length and 2 to 3 words. What's amazing is that some people with aphasia can actually recite poetry or sing songs or prayers perfectly with no problems, but they can't spontaneously speak. They can only speak in the 2 to 3 word phrases. So as neuropsychologists, when we're evaluating somebody for aphasia, we'll often ask them to try to sing a song like Happy Birthday, or try to, oftentimes if the person is religious, to say a prayer. I've actually seen patients with Alzheimer's disease relatively late in their disease who are able to recite prayers from their childhood perfectly, but they can't remember things from 1 minute to the next. Repetition is associated with problems with repetition is another disorder in production, and that can result from difficulty with comprehension, difficulty understanding what was they're being asked to say, or with difficulty in articulating, or it could be a selective dissociation between the auditory input and the speech output systems. This is the deficit that's often seen in the type of aphasia called conduction aphasia. The conduction aphasia was associated with a lesion to the arcuate fasciculus, that band of fibers, or white matter tract that connects Broca's area and Wernicke's area. We also look at verbal fluency to assess speech production. We ask people to produce words in uninterrupted strings. So for example, I might ask the person to tell me all the words that they can think of that start with the letter K. They can say any words at all except the names of people or places or any proper nouns. So there's a kind of a rule that we give to examinees. And they're asked to come up with as many words that start with that letter in 60 seconds as they can. We also look at trying to generate members of specific categories, and a very common one that people use is animal fluency. So tell me all the animals that you can think of. And so it's a little bit different type of concept, but it's also regulated by a different part of the brain. People who have temporal lobe deficits, like in Alzheimer's disease, have a lot more difficulty with the animal fluency, the semantic type, as opposed to the phonemic type, the letter fluency. Whereas somebody with frontal lobe damage, traumatic brain injury, frontal lobe tumor, would have more problems with the letter fluency as opposed to the category fluency. We also look at writing, and writing difficulty could be due to, again, a lot of different things. It could be due to a disturbance in their movement ability and the distal musculature that allow them to move the pencil across the paper and produce letters and words. They might actually have difficulty recalling the form of letters or the movements to produce the form of a letter. And there's a condition called paragraphia, where the person writes the incorrect word. It's sort of like some of the substitutions that we talked about on the preceding slide, or they will perseverate and write the same word over and over again, or at least several times. We talked about prosody, the tone or melodiousness of language, so the loudness of somebody's voice, relative duration of phonemes, and vocal pitch can all play into prosody. There's another condition of the musculature in the larynx called spasmodic hypophonia, where people have difficulty speaking and exerting prosody because their muscles in their larynx are not functioning. They're spasming, essentially, and not being able to flex as much to produce the sounds that we know and we look for in producing prosody. Following brain injury, stroke, and things of that nature, three types of prosody problems we might see is hyperprosody, which is an exaggerated prosody, sometimes characterizing mania. We rarely see hyperprosody in aphasias. Dysprosody is a distorted prosody in which listeners perceive a foreign accent. So in this case, a lot of people will be in the news because they have a stroke, and then when they speak, it sounds like they're speaking with a Welsh accent or a German accent, whereas they didn't have that before, and they're as American as they can be. Aprosody is the attenuation or lack of prosody, such as that seen in Parkinson's disease. Linda Ronstadt is a famous musician and has been afflicted with Parkinson's disease for almost 20 years now. She was just on, I think, 60 Minutes this past Sunday, and you could hear that sort of aprosody in her voice because she is, because of the Parkinson's disease, it's really constricted her ability to express those ups and downs or that melodious quality to language. So as you can see, there's a lot of things that affect speech production, and when there's a difficulty in speech production, we have to go through each of those different qualities and try to tease apart what might be causing that production difficulty. Prince?
Yeah, right. So where will you put people whose tongue is?
People who stammer. So stuttering is, again, I'm not a real expert in stuttering, but there are, I think, there's a different pattern of brain organization or difficulty with brain organization that causes people to hear what they've said already, and it throws them off. But again, I'm not really a great resource on what what the neural mechanisms of stuttering would be. I think stuttering is what you're.
Stammering.
So
stammering, like the difficulty producing the word, and most of them before even they produce the word, like they struggle and it's go along with some body movements before they can begin to talk. Yeah.
And is that the stammering in the sense of like normal difficulty trying to express oneself, or is it the condition where people actually stutter? Or
they are finding it difficult to bring out the words.
Yeah.
Like they know what they're going to say, but they find it very difficult to communicate it out.
I think that's more stuttering.
Last time, Merv
called stuttering. But
last time, Merv, you said that she's shaking the Christian view of Jews, but there are really three components to it.
Auditory delay, like
yeah.
delay in hearing or
Yeah, so I thought it was sort of an auditory processing difficulty. Yeah.
I have met someone who has the repetition issue. My child's a pediatrician, so he's a very intelligent man, but he like repeats the same sentence like 34 times. Yeah, like the same, or like the last part of what he said, he'll repeat it 3 or 4 times just to himself.
Yeah, sometimes that's a stereotype behavior that can sometimes be seen with some people, and the question is, again, as a neuropsychologist, I would have to try to tease apart whether that's something that's more behavioral in nature, that they've acquired that habit of doing that. There are a lot of people who, well, a lot of people who add words like and you know what I mean,
Yeah.
So is that that's not really a neural type of behavior, or neural type of problem. I would say it's more of a learned type of habit. But disentangling those is sort of what we're often tasked with. So turning to away from production and toward comprehension, there's a lot of different things that can explain difficulty with comprehension. Some people will act as if the word was not heard at all. Sometimes people have difficulty attaching meaning to the words as if it's in a foreign language. Some people have impairment if the words are presented in isolation rather than in a complete sentence. Some other people might have difficulty with grammatical construction, the lost man's wallet versus the man's lost wallet. You have to think about that a little bit, but some people would not be able to tease apart what was lost, the man or the wallet. And it is kind of interesting, this failing to attach meaning to a word as if in a foreign language. Many times I would have to do testing with some of the hockey players who came from Russia or Finland or Sweden, and they didn't speak very much English. So I had a word list. I would read them a list of words, and they were supposed to repeat back as many words as they could. But the words were really just sounds to them. They had no idea what the words meant, and so it was kind of a challenge for them that kind of made me take away that experience with thinking I really need to learn Swedish or Russian to do this right. Visual comprehension is associated with difficulty with reading. disturbances in reading commonly associated with impaired auditory comprehension, but reading problems independent of auditory comprehension can also occur. Visual comprehension can really run the whole gamut, might be involve deficits in recognition of individual letters, words, symbols on a page, or sentences. Some people, as we'll see, do letter by letter reading. They read the letters that they see and they try to string them together in order to pronounce the word. Other people will recognize words but that they know, but they can't pronounce words that are nonsense syllables. This is a very famous picture called the cookie theft picture. I think there's an updated version in your textbook. But this is a stimulus that we often use to evaluate the ability to produce speech. So we would have somebody describe what is going on in the picture. Anybody want to take that on? Go ahead.
So the mother's washing dishes and her sink is overflowing. And the kids are in the background. The boy is about to fall off a chair, and he is trying to reach for cookies inside the jar.
Perfect. Yeah. So, that's an example of.
Right?
Yeah. That's obviously what you expect. Phrase length was greater than 2 or 3 words. Much greater than that even. And you attended to everything that was going on in the scene. There's a lot going on there, and so it's easy to use that to help elicit a description of a verbal description of what's going on. So looking at some types of aphasias, we'll start off with Broca's aphasia, since we all know and love that one, and familiar to us. Broca's area, we know, is near the face region in the primary motor cortex. So that's talking about the motor homunculus. Broca's aphasia, Broca's area rather, is right in that area where the face is represented along the primary motor strip. Wernicke suggested that Broca's area might contain memories of muscular movement sequences that are needed to articulate words. So there might be pre-programmed motor sequences in that area that, if damaged, would not be able to be used any longer. Other speech deficits that we often see with Broca's aphasia include agrammatism, so difficulty using grammatical constructions. We'll see an example of that in a second. Word-finding difficulties, or anomia, and then articulation difficulties, producing those literal paraphasias. Instead of saying lick stip, what am I trying to say if I say lick stip?
Lipstick.
Right. And tom? Could be time or comb. Yeah.
Sounds like little children's speech.
Yeah, their little Broca's have little bit of Broca's aphasia. Or it's really more just a little paraphasias. And as we know, again, this is Broca's area, Wernicke's area in the posterior temporal cortex, and extending a little bit into the parietal. Broca's aphasia, people with Broca's aphasia, they will not use a lot of function words, but they'll use more content words. So by function words, I mean articles and prepositions. You won't see them say a and, the, in, about, things like that. They'll use more nouns, verbs, adjectives, and adverbs. Somebody with Broca's aphasia describing the cookie theft picture. Candy, cookie, candy. Well, I don't know, but it's easy does it. Slam, early, fall, men, many, no girls. Dishes, soap, water, falling, that's all. So you can having seen the cookie theft picture, you can kind of get a sense of what the patient is trying to say, but again, there's no function words that are linking together the content words. Comprehension is generally better than expression. The lesion involves a lesion to the left inferior lobe, inferior frontal lobe, but it also involves a lesion to the basal ganglia, especially the head of the caudate nucleus. If we look at some of the subcortical features of Broca's aphasia. It's characterized by slow, laborious, non-fluent speech. Interestingly, there was a genetic study by Watkins who studied 3 generations of a family with a severe inherited language disorder caused by a single gene mutation on chromosome 7. That mutation caused abnormal development in the caudate nucleus and left inferior frontal cortex, the exact same regions that are affected by Broca's aphasia. And indeed, all of these people had the Broca's type of aphasia. It was associated with more developmental difficulties as opposed to traumatic injury. Nina Dronkers did an interesting study back in 1996. And she reported that the left precentral gyrus of the insula is a key location for speech articulation. There's a condition that we sometimes see called speech apraxia, and since we just talked about apraxia, it's a disorder or impairment of the ability to program the tongue, lip, and throat movements. One way to test for speech apraxia is to have the person do some movements with the mouth, like stick out your tongue. Put your tongue between your lower teeth and your lower lip, and things like that, and watch whether they're able to do that. That can help screen for speech apraxia. This is again just a study from your textbook showing that there's a major contribution of the insula or insular cortex in the frontal lobe, in addition to Broca's area and the caudate nucleus of the basal ganglia. Some interesting functional imaging studies described in your textbook. A couple of studies showing that pronouncing words activates the left anterior insula. Another functional imaging study showed that Broca's area was activated when people learn an artificial grammar. Another study showing that Broca's aphasia disrupts the ability to use word order to decode a sentence. This is agrammatism. So if I say the horse kicked the cow, which picture shows what I just said? Yeah. So a person with Broca's aphasia would have considerable difficulty determining whether it was the horse that kicked the cow or the cow that kicked the horse. So that's the form of agrammatism that Broca's aphasia is associated with. Interestingly, there's a phenomenon called the tip of the tongue, or tot phenomenon. And so we've all experienced this, where what we want to say is on the tip of our tongue. We can't quite come up with a word. But people who have difficulty thinking of the correct word to say, knowing what they wanted to say, showed actually a loss of gray matter in the left insular cortex. These are people who have this difficulty often, not just the transient thing that we all experience. In terms of speech comprehension, we're talking more about Wernicke's type of aphasia. And when you think about it, speech comprehension is pretty complex. We have to analyze the sounds that we hear. Not every sound we hear is speech, so we have to differentiate the sounds that we hear from in terms of speech versus non-speech. If it's speech, do we recognize the word? Do we understand what the word means? And memories of sound sequences. When we put certain sounds together, we're used to hearing those. If we listen to other languages, for example, there are certain sounds in other languages that are not as common. Most of speech comprehension seems to be linked to functioning in Wernicke's area. These are neural circuits in the middle and posterior parts of the left superior temporal gyrus. In Wernicke's aphasia, the speech is generally fluent and unlabored. It almost sounds like the person is sort of saying random words. And if you're not listening carefully, the prosody is there, and it almost sounds like they're saying something. But if you listen carefully, the sound, the meaning, there's no real meaning to their speech. The melodic line is maintained. The speech is often grammatical, where function words are used. Sometimes complex verb tenses and subordinate clauses are used. But in contrast, there are a few content words that are used. The person with Wernicke's aphasia has significantly impaired comprehension, but they don't recognize their deficit. You speak to them, they respond, and then they get upset when you don't do what they said, but they have no idea what they said, and you have no idea what they said. Person with Wernicke's aphasia has what's called a receptive aphasia. Somebody with Broca's aphasia has an expressive aphasia. So Wernicke's aphasia seems to kind of focus in on difficulty with memories of sequences of sounds that constitute words. Interestingly, this Wernicke's area has been tied to learning ability. In one study going back a few years, the length of the apical dendrites in the pyramidal cells in Wernicke's area were positively related to a person's educational level. The more education somebody had, the longer the dendrites in the pyramidal cells in Wernicke's area. Pure word deafness is another type of comprehension difficulty. So recognizing a word is very different from understanding it. Damage to the left temporal lobe can produce a disorder of auditory word recognition called pure word deafness, where they can hear but they can't understand speech. So they're essentially deaf for words. And this is a lesion that caused pure word deafness in this particular patient. So pure word deafness is caused by damage to Wernicke's area or interruption of auditory input from the primary auditory cortex. There are a lot of subcortical components of language, and John Hewlings Jackson, the famous neurologist, British neurologist, proposed that there's those subcortical structures are critical to language ability. Penfield and Roberts found that the pulvinar nucleus in the thalamus functions to coordinate the activity of cortical speech zones, and stimulating left ventro-posterolateral and pulvinar nuclei of the thalamus will actually produce a speech arrest, naming difficulties, perseveration, and reduced speed of talking. All right, I'm going to stop there, and we'll try to finish off. If